When we get started. So thank you everybody for joining. Welcome to BC Women's Research Rounds. I'd like to begin by acknowledging that we are uninvited guests on the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. And as a provincial research institute committed to improving the health outcomes of women, including those across the 2SL GBTQIA plus spectrum, we recognize our responsibility in the collective efforts towards establishing culturally safe healthcare systems and services that address health inequities among Indigenous peoples, especially Indigenous women, girls, and Two-Spirit peoples. And as we are together today, I just encourage you to reflect on your own positionality on these lands and your personal commitments to reconciliation. And I'm also just very mindful that earlier this month, on the 5th of May, we marked Red Dress Day, which is an annual national day of awareness for missing and murdered Indigenous women, girls, and Two-Spirit peoples. And I think, this really offers an opportunity to reflect on the ways that, we as a research community aim to honor and meaningfully include the voices of Indigenous women, girls, and Two-Spirit peoples, and traditional ways of knowing and the work that we carry out so that all people can benefit. So with that, I am very, very pleased to introduce our round speaker for today. Dr. Alison Izat is a physiotherapist and an inflammation scientist at the BC Injury Research and Prevention Unit at BC Women's Hospital Research Institute and a clinical assistant professor in the Department of Physical Therapy at UBC. Her research applies implementation science methodologies to advance the primary prevention of knee injuries in adolescents in real-world settings. And she has a focus on reducing gender disparity for girls and women in injury risk and decreasing the long-term injury burden, things like knee osteoarthritis. She prioritizes meaningful engagement with research users across the research process to maximize impact. So with that, I will turn the floor over to Alison.
Great. Well, thank you very much, Catherine, for the introduction, and I will just share my screen here. And hopefully
looks great.
Everyone can see that. Excellent. Well, yeah, thanks again to the Women's Health Research Institute for having me share some of my work today. I'm really excited to be able to do this presentation and be able to, again, sort of I guess, share some of the current work that I've been doing, but also just place this work in the context of the bigger field of knee osteoarthritis. And please, as we're going, feel free to pop any questions in the chat. We'll definitely have time for questions at the end. So I'd also just like to acknowledge that the land on which I'm joining the call today is the unceded territory of the Coast Salish people, the Musqueam, Squamish, and the Tsleil-Waututh Nations. And I'd like to pay my respects to the elders past, present, and emerging. And this is a really beautiful, I think, piece of artwork that's called Bead Your Province. And it was created by Indigenous artists across the country. And I think, again, it reflects the diversity of Indigenous cultures in mosaic form. And again, just so we're aware that in Canada, there's more than 630 different recognized First Nations governments or bands representing more than 50 distinct nations and languages. And I realized I have that little star there on the picture, which is just something I added because I used this for a presentation I was doing for some colleagues in Australia. And so I was trying to show where Vancouver was. So that's why there's a little star there. And also just, again, as Catherine already said, I am a physiotherapist. Clinically, I still practice 1 day a week. And so that obviously influences my perspectives. And as well, I'm currently also the national lead for a program called the Good Life with Osteoarthritis in Denmark, Canada, which is a bit of a mouthful. We call it the GLAD program. And this is a group-based education and exercise therapy program for people with knee and hip osteoarthritis. Again, happy to answer more questions about that later if people are interested. But the purpose of this talk and over the next hopefully 40 minutes or so is for you to become aware of the long-term health consequences of sport-related knee injury for adolescent girls and to be exposed to the evidence on the effectiveness and the challenges related to implementation of injury prevention programs in girls' sport. So first, let's just imagine you're a 14-year-old soccer player, in the middle of a game, racing down the field for a ball. You make a quick change of direction and then feel a sharp pain in your knee as you collapse to the ground. So in that second, you've torn one of the main primary stabilizing ligaments of the knee, or anterior cruciate ligament. Now, standard management for an ACL rupture is most children, especially, or adolescents, will have reconstructive surgery, typically, again, followed by 1 year of extensive physiotherapy and rehabilitation. And after that, it's really only about 50% of people who will return to the same sport at the same competitive level. And then in the longer term, it's about half of people that will go on to develop post-traumatic osteoarthritis, which is a chronic painful disease without a cure. And really this is, the motivation behind my research program. So let's just take a step back for a second. And we know how important physical activity and sport are for healthy development in adolescence. I have on the slide there, we know it's important for the health of bone and muscles, improves mental health, and decreases cardiometabolic risk. However, sport participation is also the leading cause of injury in Canadian youth. And some studies in Alberta suggest that about 1 in 3 adolescents will seek medical attention on an annual basis for a sport-related injury. And about 40% of these sport-related injuries involve the knee. And again, sort of as I already mentioned, is that these injuries result in the short term in pain, reduced function, reduced quality of life, often a lot of psychological distress and social isolation, and of course, reduced sport participation. And then that increased risk of post-traumatic osteoarthritis in the longer term. So let's just touch base a little bit more about what is osteoarthritis. It is one of the leading causes of disability globally. So it affects about 595 million people around the world. And the knee is responsible for the largest amount of burden. So it's a chronic disease characterized by persistent pain, mobility, disability, and long-term reduced quality of life. And while it is more common as people get older, it is it's a bit of a myth that it only affects older people, and that in fact, about 1 in 3 people who are diagnosed are under 45 years of age. And so in Canada now, about 4.5 million Canadians are diagnosed with osteoarthritis, but this is projected to increase to, again, over 9 million in the next, couple of decades. And the economic costs, of course, of this are huge. A lot of this comes down to things like lost work productivity. Again, if people are diagnosed in their 40s and they're unable to work, they're on disability and leave, that's obviously a huge cost to society. And post-traumatic osteoarthritis, so really the osteoarthritis that I'm talking about, where people have had that previous joint injury, again, represents roughly that 15 to 20% of all osteoarthritis. So that's not everybody. It's really a subset of this osteoarthritis. So again, when we think about 4.5 million Canadians with osteoarthritis, we might have about 1 million of those where they have this history of joint trauma. And usually, at least from a research perspective, most of the research on post-traumatic osteoarthritis has involved injury again to the anterior cruciate ligament, which is this kind of main ligament here in the center of the knee joint, or the meniscus, which is really a cushion that sits in the interarticular space here. And the role of the meniscus is to help distribute load across the joint. So again, either injuries to this anterior cruciate ligament or the meniscus can be really problematic to the long-term health of the joint. So sometimes these people who've had previous knee injuries have been referred to as young people with old knees. So again, just to orient you a little bit to this graph, what we see here is the pink line and the green line are what would be sort of the normal proportion of the population who gets osteoarthritis. So you can see here, like as we're getting older, like let's just go here to 55 to 62, we're looking at potentially, 10 to 20% of people are starting to have signs of osteoarthritis. This is people who haven't had a knee injury at all. So these are sort of those regular people. Now, when we look from a research perspective, This is a study where it was women soccer players who'd had that anterior cruciate ligament injury, and 12 years after the injury, we're seeing that 40 to 50% of people have knee osteoarthritis. And we see similar things when we look at here's men soccer players at 14 years after injury. And again, here we go, looking at the meniscus as well. Very similar. So obviously a really big difference between what we'd see in sort of the general population versus these athletes who've had previous knee injuries. So when we look at what this means for women in particular, we know that girls, especially age 14 to 18, have anywhere from 2 to 6 times greater risk of this knee anterior cruciate ligament injury than boys. And there's lots of potential reasons for this that I'll get to in a few slides. And then we also know that women account for 2 out of every 3 people who have knee osteoarthritis. And not only that, when we look at, again, what's happening, how are women living here with osteoarthritis, we can see that women have more severe pain based on similar radiographic changes in their joint, so joints seen on x-ray. Women have greater limitation in function, and they have increased pain medication use as well. And then conversely, we see that women compared to men typically have less joint replacement surgery, and then they have poor prognosis after surgery. So again, this is not trying to be depressing here, but again, this is just the reality of what we see in the research. And again, the last point here is that often people will think of osteoarthritis and say, oh, well, yes, it's a chronic disease, but it's not, it's not like cancer. It doesn't kill you. But actually, we now do have research that we do see people with osteoarthritis have increased risk of all-cause and cardiovascular disease specific mortality. And the reason for that is thought to be that the joint inflammation that is part of osteoarthritis is actually part of a larger, becomes a systemic inflammation that again affects the joint, but also affects the heart and other parts of the body. So we do see this link between osteoarthritis and mortality as well. And I just put this little picture of this Arthritis Action Now up to remind myself to mention that the Arthritis Society of Canada has just released actually a really landmark position paper looking at sort of their action plan moving forward. And excitingly, there's actually a big emphasis on prevention and on specifically, again, like these sport-related injuries in youth, as we need to prevent these early because it is a significant risk factor for developing osteoarthritis later in life. So let's move into sport, and specifically soccer is where my research is. And that's really because in Canada, soccer is the most popular sport played by adolescent girls. And then that also makes it one of the highest risk sports for having this anterior cruciate ligament injury. So again, when we look overall in soccer, we see this overall incidence of about 3.4 injuries per 1,000 hours of play, which again doesn't sound like a whole lot. Again, ACL injuries are not the most common. We actually see more ankle injuries, general knee injuries, and hamstring injuries. However, again, as I mentioned, the burden with anterior cruciate ligament injuries is much greater. And so that's, again, where we put a lot of emphasis. And as I mentioned, soccer is the team sport with this highest incidence of injury. And this ACL injury has the highest burden in terms of recovery time. Again, we're looking at upwards of a year recovery time, increased re-injury risk. In adolescents, we typically will see about 25% will re-injure, and then the long-term health, as I already mentioned. So how do these injuries usually happen? In fact, more than half, and in particular in girls, tend to be non-contact injuries. So just as I mentioned at the very beginning, somebody might just be running down the field and make a quick pivot or a quick change of direction, and then all of a sudden they feel this giving way in their knee and a sharp pain, and that's when they've torn the ligament. So it does happen in a contact situation as well, where people are going for the ball, but it's actually more common in this non-contact situation. And again, it's thought to be due to sort of a complex interaction of multiple factors, which I'll get to here in a second. And as I already mentioned, women are much more likely than men. And again, it depends on what statistics you read, but here, women are 3 times more likely during competition and 2 times more likely during training than men to have these knee injuries. And as I mentioned before, the peak age for these injuries in girls tends to be 14 to 18. Men, again, still never reach that same incidence level, but the peak age for men does tend to be a bit older. And I mentioned that it is multifactorial, the different risk factors, and obviously very complex. And I've divided these sort of risk factors here into 2 groups. So we have sort of this team nature over here, which would be, sort of these more biophysical factors that, we can't do anything about: age, sex, genetics, at least at this point, hormones, some of these things, although again, previous injury, we can prevent that potentially, as I'll be getting to. But again, these are more team nature. And over on this side, these are a lot of things that can potentially be changed. So things like movement patterns, muscle function, sport specific skill, these are all things I'm going to be talking about in a second here. But even things like shoe surface interface, training load, psychological factors. These are the areas that we really want to be exploring more. So again, I've probably drilled this point home enough times by now as, why should we care about these injuries? And I think I've touched on all of these points, but we do actually also have research looking at that after these injuries, we do see increased in obesity and reduced long-term physical activity in the long term in this group. So again, looking at all these together, we see women and girls have lower return to pre-injury sport, there's greater knee instability and more psychological distress than male athletes, men and boys. So I wanted to share a little bit of work that I did a few years ago now. This was actually part of my PhD that was published in 2021. And so the impetus for this work was that at the time, especially, most of the research was really focused on this idea about return to sport, and especially, again, returning to sport at the same competitive level as they were at before. And I mentioned in that earlier slide that it's only about 50% of people who return to sport at that same competitive level. But I was more interested in actually looking at their physical activity participation after ACL injury. And so for this study, I recruited 51 pairs of girls aged 13 to 22. And so I had 51 who'd had that anterior cruciate ligament injury 1 to 2 years ago, because I wanted them to be sort of what we would say, at least, what we learn in physiotherapy school is you're recovered after that 1 to 2 years post injury. You've had your surgery, you've done your rehab, and you should be, back to normal. So I recruited the 51 injured girls, and then we also I had them help me recruit a matched pair. So someone who was actually playing ideally on their sport team at the time when they had their injury, who'd never had any injury before, so the same age as well. And so I had these 51 matched pairs and collected a few different outcomes, but my primary outcome was looking at physical activity with accelerometers. And so interestingly, what we found was there was no difference in moderate and vigorous physical activity between those who'd had the knee injury, the ACL injury, and those who hadn't, again, at 1 to 2 years post surgery. And that was really good, of course. And again, that was despite, again, only 54% returning to sport, which is, again, what we would expect based on other research. However, there were, some other findings that weren't so good. When we again compared between the groups, those girls who'd had the injury had significantly reduced vigorous physical activity. So they weren't pushing themselves to that, higher level of really, again, more vigorous physical activity. But then probably, again, more somewhat surprising for me, although maybe I shouldn't have been in some ways, was that these girls, even though they were quite physically active, they were having quite high levels of still ongoing knee pain and symptoms and reduced quality of life and poor objective knee function. So they weren't back to, normal to what they had been before the injury. And yes, in a good way, they were getting, some moderate to vigorous physical activity, but there were obviously still some concerns in this group. So that was the take home from that study. This was a systematic review that I was part of during my postdoc in Australia that was led by a colleague of mine, Andrea Bruder, that I wanted to share as well. And so, again, the impetus for this was that again, we already know that female athletes, women and girls, have this higher rate of injury compared to men and boys. And this systematic review looked to investigate whether there were sex and gender differences in perceived activity and knee-related outcomes after ACL injury. And so again, in this was a massive systematic review. It says here 245 different studies. And you can see there a lot of participants and 43% women. And we did 35 different meta-analyses. So I'm not going to obviously share all of those with you. And just a little caveat that, again, most of the studies included did have at least some risk of bias, and that all of the results in these meta-analyses were rated as low certainty evidence. But just to share some of the key findings from these meta-analyses is that women and girls have a 25% reduced odds of return to sport within 5 years compared to men and boys. We also saw women and girls have inferior knee-related outcomes, particularly in that sport and recreation domain. And then again, just to summarize, this is that, of those different 35 meta-analyses that we did, women and girls had inferior outcomes in 26 of them, although none of them found poor results for men and boys. So, definitely a pattern there. Even though we do need more high quality research, there's, certainly a pattern we can see there. So the take home messages from this systematic review, again, is that, after these injuries, many women and girls may not return to sport. They're experiencing difficulty with sport and recreation and experiencing worse quality of life. And so I just wanted to, again, touch on, why are women and girls having this increased risk of knee injury compared to men and boys? And this idea about gendered environmental risk factors is a relatively new sort of area of research in ACL injuries. And that's because really for decades, there's been a much larger focus on what we would call sort of those biophysical factors. So things like anatomy and biomechanics and hormones, and sort of saying that, all of these are the reasons why women and girls have more injuries than men and boys. But, even when we've been studying all of those for, again, decades, we still can't seem to be able to really explain fully this increased risk for girls and women. And so there's been this shift to really considering more of the sociocultural factors. And so some of these risk factors are things like foundational movement training. And so, look, we know that traditionally boys get more exposure to athletic movements at an earlier age. And so we need to be a little bit more intentional about introducing these movement pattern training to girls. Another area is when we look at strength training. And again, traditionally, many girls will shy away from doing strength training. They may be intimidated in a gym environment. There is still myths that persist that, if you lift weights, if you do strength training, you're going to end up being, really big and bulky. And so we need to work to provide education and better supervision and build confidence to do strength training. As well, when we look at different access to resources and facilities, unfortunately, we still know that in a lot of cases, girls' teams, women's teams will get inferior access to, for example, the fields that have more ruts and roots in them potentially, or even access to, strength training equipment. There's the example I always think about of where just in 2021 at the NCAA March Madness basketball tournament, the male athletes, the college athletes in that were given access to a full gym, fully equipped gym area, while the women athletes were basically provided with a few light dumbbells and yoga mats, and that was all that was done. And so these sort of things are still happening, unfortunately. And another area is we need to have a better understanding of managing other competing demands with the workloads of being an athlete. And again, not just a professional athlete, but we often see that women are juggling many other activities, not just playing sport. And I guess that would also be at a professional level as well, is that many men professional athletes, they're playing their sport, that's their job, whereas women who aren't getting paid as much will often have another side job as well. And then the last thing here is, again, enhancing the cultural acceptance of sport participation for women, and really looking at making sport inclusive for all. And so these are some of the areas, again, that the field is moving at that we need to address if we really want to be getting more equity in reducing women's and girls' knee injuries. So I'm going to shift a little bit here now and talk about exercise-based ACL injury prevention programs, because this is something we actually do have quite a bit of research to support. And again, on this slide, there's an example of some of the different evidence-based programs that have been developed. And what these programs all have in common is they typically will include some sort of dynamic warm-up. They'll include a strengthening component and usually some sort of sport-specific skill component. And again, what does oops, sorry, I hit the wrong button there. What does the research say about these programs? Do they work? And yes, so if people do the programs, then we see that it reduces these ACL injuries by 40 to 60%, which is, again, fantastic. For every one of these injuries we can prevent, that's, again, reducing that long-term osteoarthritis effect, right? And so they've been seemed to be effective in men and women across various age groups, across a variety of sports. Again, mostly those cutting and pivoting sports, soccer, basketball, handball in Europe is quite big, skiing. Those are often the main injury sports. But again, the key is that they're only effective if they are done. And unfortunately, the uptake of these programs is quite low. So again, this is what we would call an implementation problem. So just as an example, this was a systematic or a scoping review, sorry, that was done looking at nationwide injury prevention strategies in Australia. And again, 88% of studies did show that they were effective at reducing injuries, these different injury prevention strategies. But as an example here, in Sweden, again, when we look in 2008, 21% of soccer teams were using these injury prevention programs. And then between 2008 and 2015, there was a lot of work done to try to improve this implementation. And yet we're seeing no change really in the increase of use of these programs. So I'd like to ask you guys maybe in the chat here, does anyone have any ideas as to why is it so difficult to use these programs? Why do you think they're not being used when we have this evidence that they are effective? I'll see if maybe I should just stop sharing for a second so I can see the chat better. Has anyone? Let's see, insufficient training for coaches. Okay, yeah. Yeah, I'm gonna wait till we put it up here. Hard to motivate yourself to do them. Behavior change is much harder than attitude change. Yes, yeah, I agree, Lori. Nice. Yeah, excellent. Yeah, generating buy-in from all knowledge users. Yes. Yeah, Rosie, yeah, okay, awesome. Well, I'll go back to my slide here. It's definitely multifactorial, right? As sounds like you guys are probably aware of here too. So I should be back on my screen there. And I said, well, how do you think we can provide better support? I'll get to that actually as in my slides as we're going. But I just thought I would share this was some just word clouds that I made from some webinars that I did with the soccer community that is part of my research. And so if we look at this sort of orange and red one, again, this is by coaches and parents, but you can see lack of knowledge, lack of resources, lack of time. Those are really some of the big ones here. Access to facilities, lack of seriousness of girl programs. So again, there's lots of multifactorial barriers here. And then when we look at these green ones, as you know, these were their ideas of, how can we better support the use of injury prevention training, things like training coaches, educating parents, club-wide programs, make it mandatory, educate the players. So again, lots of different ideas here. And so again, we have this information, we have this knowledge, we know it's important, but as Lori said, the behavior change part is really hard. And so, as I said, we've had these systematic reviews that have looked at the effectiveness of these programs. And we know what the general components need to be in these programs, and we know they're effective. But really where the field is moving now is into this idea of how do we help support the implementation. And this is, I was just going to share a couple of slides from this project I was a part of, which is actually it's a massive consensus. So FAIR, the Female, Women, and or Girls in Athlete Injury Prevention. As I said, it's a massive project that has been sponsored by the IOC, or the International Olympic Committee. And it includes 5 different systematic reviews, as well as this scoping review, and as well as a concept mapping study. And it's led by Carolyn Emery and Kay Crosley. And I was part of the author team for this dissemination implementation scoping review. So I just wanted to share a little bit of the results here. And so, as we've already touched on, we know that just because we have the evidence for these programs, it doesn't always translate into the real world. And so we need to have these deliberate strategies for helping to support the implementation of this evidence into practice. And again, we also know that what works in one context might not work in another. So we do have much more research looking at men and boys, and we can't just assume that we can do the exact same thing and that it's going to work for female, women, and girl athletes. And so, again, the main research question here was to synthesize the evidence related to dissemination, implementation of injury prevention interventions in female, women, and girl athletes. And so, again, we had a lot of papers included in this. But what is interesting is a lot of these dissemination and implementation outcomes were not the primary outcomes of the studies. They were often quite buried, as secondary or exploratory outcomes in a lot of these studies, because it is, excuse me, a relatively new area that's been investigated. But as you can see, we looked originally at 22,000 papers, and we did a rapid screen. And then did full text screening of over 2,000 papers to come down to these 220 papers that were included in this. And you can see just a distribution of the type of participants, adolescents, children, although, very few, relatively speaking, on children. Again, amateur, sub-elite, and elite athletes, and again, very little on parasport athletes as well. Okay, so just again, to provide a really high level summary of some of these results, I think what this image is showing is just sort of highlighting the number of studies by the level of sport environment that they targeted. And what you can see here is that most of the studies were focused at the individual level, so on the athletes, and then also on the coaches at these 2 levels. But there's certainly a gap here that we need to be thinking even bigger picture, looking at a club level, at a policy level, national sporting levels, that really this is a multi-level problem, and that we can look at this socioecological model, that there's probably more we can do to target these more outer layers. So again, just to summarize some very high level key findings here, and these were the things that we found that were what were the modifying factors, or what were in this case, the green is the facilitators versus this yellow is the barriers to implementing these programs. So programs that were more adaptable. Again, programs that were adaptable, that looked at different progressions and tailoring, especially for the younger age children. And I'll come back to that a little bit later as well. These programs had to be engaging and sport specific. And then when we looked at different barriers, again, if the interventions were boring or, too difficult for a younger age, that was obviously a barrier. The lack of perceived relevance from athletes, again, lack of time, coaches not having skills and knowledge, not having education and support and staff to implement. So again, some of these ideas that you guys put in the chat for sure. And so from a research perspective, again, what have we found to be effective at helping to support the implementation of injury prevention initiatives is that there does need to tend to be an education component, especially, again, most of the research has focused on coach education at this point. Sometimes it's done online, sometimes it's done in person with a practical component. Again, often done in preseason with in-season support seems to be best. Looking at who are we targeting. Again, most of the studies target the athletes and coaches directly, not necessarily the other people such as, club technical staff, club leadership, this professional association. And again, these programs are sometimes delivered by the researchers or the experts themselves, sometimes delivered by physiotherapists, or sometimes using more of what we call like a train the trainer model, where the research team is training, for example, some coaches to then train the other coaches in how to do it. So there's been some variety. But again, this is really an area of the field where we need a lot more work. And so this is again what my emphasis has been on. And I just wanted to put this up briefly before I get onto my other research, just again to show if you want to access, there is a very all these resources are up online at thefairconsensus.com. Again, the 5 systematic reviews, scoping reviews, recommendations, and everything. And this was an amazing project that I was lucky to be a part of. So now I'll talk about, again, the current work that I'm doing right now. And this is my research program that I was very fortunate to receive Health Professional Investigator Award from Michael Smith Health Research BC. And so I've been working on this now for almost 2 years, which is hard to believe. And as Catherine mentioned at the beginning, a really important part of my work is partnering with the community. And this type of implementation work really does not work unless you have community members who are, engaged and keen to be involved. And so I've been fortunate to have BC Soccer involved from the very beginning of my work, from my initial application, which was in 2021 for this work. And also I have 4 clubs that are partnering throughout all of this work with me, as well as Sport Physiotherapists BC as well. So now I'll talk a little bit about this work, but actually before I get to the work, I did also just want to mention my community advisory board because they've been, again, really instrumental in this work from the very beginning. And we've had 8 meetings so far, actually, sorry, 7 meetings. We're about to have another meeting. And these are 2 of the players who are on my community advisory board here. Katie and Ailey are 2 of the soccer players. And I also have some coaches. Again, I have someone from BC Soccer. I have an orthopedic surgeon, another physiotherapist, a parent. So we have a great group. And one of the things we did at the very beginning was we co-created our terms of reference, did some different activities to look at our values and, why this research matters. They've been instrumental in, helping me do some different webinars and having some different player workshops as well to really get, again, the clubs engaged in this work at an early phase, because really without them involved, none of this work is going to be possible. So I just wanted to show again some of the some pictures from one of the workshops I did last year, where this is with North Shore Girls Soccer, and they have this bubble, they call it, which is an indoor soccer facility, which is really great to have in the winter here in North Vancouver. And so I did a little mini presentation, a true false game, and then I had them rotating through some different exercise stations, and then also doing some different brainstorming on these whiteboards. So, again, asking the girls what's their motivation for injury prevention and how can we better support injury prevention. And I don't know if it's if you can read these, if it's a bit small, but motivation for injury prevention, there's I love social activities, fun, talking, rewards. They want candy, merch, and gift cards. So getting all kinds of ideas from these girls, but it's been really fun to work closely with them. So when I shift over to the research side of things, this is sort of the first study that I started as part of this 5-year program. And thank you to the Women's Health Research Institute for helping me to do this work with a Catalyst grant. This is a screenshot from a poster that I did. This work is about to be submitted for publication, almost there, but not quite. And so what this study was is interviewing the implementers. It was actually originally going to be interviewing physiotherapists as the practical implementers of injury prevention programs in team sports, and then also interviewing international research experts in injury prevention program implementation. But we ended up splitting this project into 2 separate projects. That's why this is called 1A. So I'm going to share both projects with you now. But this first one, so this was focused on interviewing physiotherapists in British Columbia who had experience working in an injury prevention role with girls team sports. And I think the quote here on this poster really does a good job of capturing the take-home message. Injury prevention is more than just a program, it's the whole context. So I'll dive into this a little bit more. But just again, the methods for this was that I purposely sampled 18 physiotherapists, again, looking for some diversity in mean clinical experience, diversity in where they were from across the province. So ones who were more in urban versus rural settings, and a few different teams as well, not just soccer. So we had ones involved with basketball, with rugby as well. And we did semi-structured one-on-one interviews with them. And then this work was inductively and thematically analyzed. And so this is a high level summary of what were their sort of key take homes of how do we improve this injury prevention implementation in girls sport. And so I've divided these up here again into strategies targeted at the player level, more at the team level, and then again, more sort of at that club or association level. So when we talk about the players, I mentioned this earlier from some of the research is that they really thought we need to be doing this foundational athletic movement at a young age. Is that if we don't start doing this injury prevention training until they're like 13 or 14, they're already having those injuries. So we need to be introducing this, at 10 or even younger. Building that confidence for strength training. Again, these physiotherapists who work with these girls did say again that they are, intimidated to go to the gym. They don't necessarily understand the benefit of strength training and they don't feel comfortable in that environment, especially when there's, lots of boys around in some situations. And then another thing that seemed to come through as unique for girls is they want to understand the why for injury prevention. And this is a quote here, is there's more buy-in if you can rationalize why you're doing it. And again, this is something that I've seen echoed in some of my other work is that girls really want to understand that why, maybe in some ways more than boys is what I've been hearing. So when we move to the next level of, looking at the team level, what do we need is we need to be providing that tailored knowledge and training that matches both the coach capacity and the team goals. And again, what that means is that if we have a team that's Division One team and, highly competitive and maybe the coach has done, some training, that's going to be different than a team that's more of a Division Three, very recreational. The coach is, again, a parent volunteer who has, very little experience. We need to be able to provide a different intervention and different support for those two levels. Another thing coming through for girls is that they want to have this strong social component. Again, as you saw on my other slide, is that talking and socializing is a really important part of sport. And then fostering trust and communication across all team members. And you can see the quote there. Communication is huge. For me, it's setting it up at the start of the year and getting that routine down. And then lastly, when we move to this more top level of club and association level is we want to create a sport culture that values injury prevention. Again, a lot of people, again, I've talked to as a physiotherapist, is they never think the injury is going to happen to them. And they don't really understand the impact of what that injury will have until it's too late. And so we need to find a way to prioritize this injury prevention, not just for sport, but for, healthy, lifelong physical activity participation. And then making injury prevention a priority within club structures. And again, that's where we have much less research, but I think that's really where we need to move. And this is an interesting quote here from a physiotherapist where he said, in the boys' club, we have one main point of contact and it's very centralized. The girls' club, each team has a team manager and everyone doesn't speak the same language. So it's been much harder to kind of rally everyone. And so again, this comes back to those, maybe it doesn't seem like a big difference, at the first glance, but again, when you're really getting down to how do we help support injury prevention, if we can't all be coordinated together as a club, it's not gonna work as well. So again, the take-home message from this study was physiotherapists really emphasizing the need for this multi-pronged approach. So we can't just target the players or the coaches. It needs to be all three of those levels. And we need to think about those contextual factors. So as I mentioned, the competitive level of the team, the coach training, the culture, the resources available, all of those different things. So I'll move to, again, sort of the study 1B now. And so again, this was now interviewing the academic experts, or again, sort of the researchers globally who had experience in doing research around implementing injury prevention programs, and what sort of suggestions they had. What were their recommendations for improving the implementation of these programs? And so at this point, I've done 12 interviews, again, semi-structured interviews. And this is being, again, inductively thematically analyzed, but then I'm mapping these results to the Consolidated Framework for Implementation Research, or CFIR, which is an implementation science framework. And again, I have ongoing data collection and analysis right now, but I thought I would just give you a little bit of a sneak peek at some of these preliminary results, as I'm actually presenting a poster on this work at the Enrich conference next week. So this is, first of all, just to orient you, this is the different domains of the CFIR framework, if you're not familiar with this. When we talk about the innovation is the actual sort of the thing, or in this case, that injury prevention intervention. The outer setting, again, is going to be more of those like club level and governing body level sort of areas, where we have the inner setting is going to be more that team level. The individuals are looking at, again, the players, the coaches, potentially the club staff, and then the implementation process is, again, probably my favorite, most important one of how do we support that implementation. So again, apologies, this is a little bit small here for you to be able to see, but this is some of the key take homes that the academics or the researchers were saying, is that when it comes to this innovation or the actual thing, we need to be co-designing the program and engaging end users right from the very start. The program needs to be simple as far as exercises, but we need to embrace this adaptability and flexibility. And again, that's a real challenge in research when you want things to be, standardized if you're going to do a traditional randomized controlled trial. But what we're saying here is we need to look at moving beyond a really standardized intervention here. And then again, looking at integrating that intervention into the routines, but making sure it's fun, sport specific, and progressive. So giving them variety over time. So when we move to this outer setting, again, making those early partnerships with the governing body for implementation and sustainability was seen as really key. Building capacity and fostering that culture within clubs to commit prioritizing injury prevention. So again, hopefully you can see that we're seeing some overlap here between what the physiotherapists are saying and what the international experts are saying as well. And then ensuring equitable access, again, to these resources across the club. Moving to the inner setting here. So looking at potentially trying to find a way to use this program as a social opportunities to help players to connect, give the team a focus, and promote the cohesiveness, because we know that social factor is really important for girls. Is there a way that we can potentially leverage that? And then embedding team structures, so not just club structures, but also team structures to look at sharing responsibility and motivation for the program. Moving to individuals here. So again, when we're looking at the coaches, we know the coaches are important, that they need to have that support to build, first of all, their awareness, post their positive beliefs, and their self-efficacy. And that's what, again, the FAIR systematic review, one of the findings from there was it's not enough to have just coach knowledge, but they really need to feel confident that they're able to do this program with their players if you're going to see them make that behavior change. And then again, when we look at the players, again, especially girls, they want to understand that why from a young age, and dispelling those myths of, strength training makes you bulkier. Another myth is often that, we need to do more stretching. And so getting rid of those as well. And then lastly here, moving into the implementation process, using multi-level theory guided implementation strategies that align with the community interests. So we don't just want to pick our random implementation strategies that we think look good, but there's actually some ways in implementation science where we can build on the CFIR model. And this is what I'm going to be doing next, is using something called the ERIC tool, where we can generate implementation strategies that actually match with what these barriers and facilitators are. And then, as I've already mentioned too, understanding that implementation context. So what are the resources available? So again, as an example, when I've been talking to the teams, they don't get access to the field. They only get access to their field for their 1 hour practice. And a lot of times they want to do their warm up before that, but they've got a small sort of strip of grass to the side that might be, 10 meters by 20 meters. And that's the space that they want to be able to do their warm up. So if I give them a warm up where they need to use the whole field, they're just not going to do it. So again, it's really understanding that context that is so, so important. Okay, so I know I'm getting tight on time, so I'll quickly just share a little bit of a sneak peek. This is the study that I'm wrapping up right now because I had talked, again, did the research with the physiotherapists, did the research with the international academic experts. Now I actually wanted to talk to the clubs, the coaches, and the players themselves to get their perspective, specifically on the facilitators to implementing these programs. And so for this, I used a concept mapping approach. And I won't get into details on all of this, but there are 2 phases to this. And the first phase is a brainstorming phase. And so essentially getting the community members to brainstorm as many different responses to this prompt as they could think of, ways to support us to integrate injury prevention training into our regular soccer routine. That's the first phase, they said. And for this, I had the adults use an online software, and we did focus groups with the players. The second phase is called a sorting and rating phase. And again, for this, we did have the adults do it online, and the players we did in person, in partners with cue cards. And I can say that was an adventure. This is just a picture of actually my daughter helping me make about 2,000 cue cards to do this. And here's some pictures of some of the players doing this activity. But I think it worked really well. And the reason behind the cue cards was that some of my collaborators from Scandinavia who had done this type of research with adolescents used the software program and found that it didn't work very well, that the data that they ended up getting out of it was incomplete, didn't make sense. They ended up having to redo a bunch and not able to use a lot. And so their suggestion was to not use the software with adolescents. And so again, I'm in the middle of analyzing and things are looking really good now. So it was a lot of work to do the cue cards, to do the old fashioned way, but I think it was worth it. So again, just to share a really sneak peek, I was literally doing some of this, finalizing this last night. This little map up here in the corner shows 7 different clusters. And so we ended up with 68 different responses, unique responses to this statement. And then we grouped those 68 responses into similar clusters. And again, the community members themselves do this grouping, and then they also do the naming. And so this is, I'm just going to put these all up actually, just for the sake of time here. These are the names of these different clusters. And so again, we had statements related to creating a responsive, engaging, and supportive team-based training environment. We had statements related to developing structured, practical soccer-specific warm-ups. They wanted to support coaches with time and tools to consistently deliver injury prevention training, using digital tools and online resources, increasing motivation through social support and positive reinforcement, education. And then again, this one that is really important coming through, strengthen that organizational support for coach education and injury prevention. So again, I'm not quite done all the analysis for this, but this is again nearing completion. So stay tuned for the results on that. And so what's coming next is right now I'm planning for some co-design workshops happening this fall. And so that's going to be, again, putting together the first 2 studies with the physiotherapists, the academic experts, and then also now the player and coach data to put that all together to actually do our co-design, focusing on, again, the program, but then most importantly, the implementation strategies to help support this. And then after that, we'll be moving to feasibility testing of this in the coming year. So again, just to wrap up with this, hopefully with this presentation, you've seen knee injuries are, a serious health concern, but they are preventable. And so that's where we really need to prioritize this primary prevention. And that injury prevention programs are one way that do have solid research behind them and if they're used. And so in order to support their use, we need these multi-level implementation strategies to support behavior change, both individual and organizational. So thank you all very much for listening. And I will, I guess, stop sharing here too, so I can I can see what's going on a little better. So great.
Thank you, Allison. That's a super impressive body of research. My goodness. I'm just going to open the floor to questions. Um, Please just raise your hand or unmute yourself. But I do see one question in the chat that I'm going to read out to you. So Sabina is asking, in BC, the regular elementary school teaches children PE in elementary school, and some schools only introduce like a special PE teacher in the older grades. Would having a PE teacher in kindergarten that's trained in kinesiology and the subject make the difference? Also, not everybody can afford to put their kids in special
Mhm.
sports programs.
Yeah. For sure, and there has definitely been some work in Calgary. Carolyn Emery has done some work looking at implementing these injury prevention programs in schools, and there is evidence again of effectiveness of that for sure. So I completely agree. Is that it would be great if we can get more of this physical literacy and foundational movements happening in schools at a young age, and it's unfortunately, like, and I see this, I have kids, I have a grade 3 and grade 6 kid, and it seems like they get less and less PE time, and the teachers are not specialists anymore. They're, regular teachers who don't necessarily have, again, that expertise and confidence to be able to doing this. So, yeah, it's a really, again, like a systems level problem, I think that you're highlighting, but I completely agree that this could definitely be done in the schools as well. Mhm.
Question. Nope, we have another question here. What got you interested in this work? Also, do you see things changing regarding access to facilities, equipment for women and girls?
Yeah.
Thinking about
Yeah.
your great example there.
Yeah, yeah. So what got me interested, so I'm a physiotherapist. Clinically, I've been a physiotherapist for 22 years now. And so again, I see these girls, these athletes, and again, you have this injury, and say you're 15 when you have the injury. Again, in our system, often it takes them 6 to 8 months before they have the surgery.
Mm,
So they have the injury, wait 6 to 8 months, have the surgery. Then it's again a 1 year minimum recovery. So you were 15 when you had the injury, and a lot of them aren't going back to sport till they're 17, 17 and a half. And that's, a huge amount of their adolescence that's impacted. And again, the long-term implications are not great. And of course, not everybody has a long term. Lots of people do get back. And I would say, now that I'm in my mid 40s, I see some of my friends who had these injuries when they were teenagers. And I know some of them who are doing great, have no problems at all. Other ones who they've had basically this bumpy road of issues ever since they were in their teens. And now that they're in their 40s, it's getting worse. So that's kind of what got me into it, is just seeing that it's a problem, and I think that we know we can prevent a lot of them. And there's a whole other side of the research of after they've had the injury, can we prevent re-injury? How can we, make sure people get that proper rehab? Because there's a whole challenge there when we talk about equity, and physiotherapy and access to that is not covered either. So people are paying thousands of dollars out of pocket for that. And again, your second part, maybe just to see things changing. I think there's a lot more awareness coming in this space with women's sports, and things like this IOC sponsored fair consensus is certainly bringing awareness. And even there has been some more things in the media about ACL injuries being this big problem in women's professional soccer as well. So even the fact that we have this new, professional soccer team in Vancouver, like there is some good momentum building in this space. So I hope we can keep building on it. So yeah, thank you.
Dr. Pryor, I'll let you go and then I'll ask Lori's question that she popped in the chat.
Hi, thanks for an excellent talk. I'm wondering if the coaches in particular are still recommending to young women that they go on the birth control pill as a way of preventing further injury.
Yeah, I don't know from, again, I certainly know that that myth is out there. There is lots of work happening right now in sort of that hormone space, but certainly there is no conclusive evidence that that does prevent injuries at this point. So I don't know exactly what the coaches are saying. I haven't heard again, through the coaches that I've been talking to, that doesn't seem to be pushed, at least. I think if anything, they're not really having those conversations about injury prevention at all. And not is the conversation. But yeah, so sorry, that is
And
certainly a myth that is out there, and there is more research happening in that space.
an important thing to know is that there's strong evidence that use of the birth control pill in adolescence is preventing peak bone mass. So
Mm,
that's an important part of preventing osteoporosis
yeah,
in the future.
that's a great point. Yeah, thank you.
So Lori asks, can you talk about how your findings with the injury prevention in young girls can be applied to adult women where injury proneness is greater?
Yeah. So yeah, I guess for the specific like acute anterior cruciate ligament injuries, those are more common in the younger adolescents. But I think again, when we're talking about adult women, and I see lots of again adult women active and not as active coming in to the physiotherapy clinic as well, but it's a lot of the same principles of getting women engaged in strength training, um, understanding how important that is even as we get older, balance training. And I think this carries over into that osteoarthritis space as well, is that we have really good evidence for managing osteoarthritis that exercise is critical as that first line treatment. And yet, again, whether it's because of lack of awareness, lack of resources to be able to access it, lack of motivation sometimes, there's lots of challenges. But I think again, it's like any behavior change, Lori, as you said before, is that it's one thing to have that knowledge, but we need to think about behavior change in a lot of these cases as well. Mhm.
Great. So I see lots of thank yous and kudos popping up on the screen. So in the interest of time, I would just like to echo that and thank you, Allison, for this excellent presentation. And as you complete this work, we'd really love to be able to highlight the final findings here as well. So
Oh, thank you. Yeah, no,
very interesting.
more than happy to. As I said, it's moving forward, which is really exciting. Because as I said, when I first reached out to BC Soccer and these clubs was 2021, and I was in Australia doing a postdoc, and so now it's like, wow, it's 5 years later, and we're actually like really getting the ball rolling. So it's exciting.
Super exciting.
Hmm.
Thank you, everybody, for coming out. I
Thanks,
hope
everyone.
everybody has an amazing long weekend. Hopefully we get some sun.
Thanks.